Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about the impact of COVID-19 on the heart. I'm here today with Dr. Michael Nassif, cardiologist at St. Luke's Mid-America Heart Institute. Thank you so much for joining us today.
Yeah, thank you, Lindsay, so much for having me.
About 1 in 3 people with COVID-19 have heart disease, making it the most common underlying condition in patients with the virus. The CDC says people with underlying conditions are 6 times more likely to be hospitalized for COVID-19 and 12 times more likely to die. Throughout the pandemic, cardiologists continue to learn more about how the virus affects the heart. Dr. Nassif, as vaccines become available to more people, there are lots of questions. Are COVID vaccines safe for people with heart conditions or cardiovascular risk factors?
Yes, this has been a very common question amongst our patients, and overwhelmingly the answer is yes. And we have a lot of patients, even our heart transplant patients have now, the majority of them have been vaccinated. And as these vaccines become available, we're encouraging everyone to get one.
And as we've learned more about the virus, do we know more about why heart disease increases the risk for severe COVID?
Yeah, the answer to that's probably twofold. It's probably one, people with heart disease, whether it be congestive heart failure or previous heart attacks, they probably don't compensate as well when they get seriously ill. But the other one, probably larger one, is just that patients with heart disease, unfortunately, are commonly older. They commonly have underlying metabolic issues, which also happens to be a predisposition to getting more serious COVID-19 infections. So that's even the bigger reason that these patients in particular should be eager and hopefully be getting vaccinated very soon.
And how does the coronavirus cause heart damage?
Yeah, that's a fascinating question. We're still learning. Early on, there was significant concerns about myocarditis, which is the virus is actually directly attacking and invading heart cells. And while that certainly appears to be possible, it does look more rare. And there's some kind of controversial data about this. And the reason for that is there were some very early studies where every single person or 100 people who had COVID-19 got very in-depth testing, including cardiac MRIs and very specific blood tests for heart damage. And these studies noted that there was very microscopic amounts of heart damage, both on the MRIs and these blood tests. And so there was a worry that it's possible that this myocarditis was very common amongst COVID-19. However, as more and more data has come out, and particularly from both Harvard and Emory recently, patients with actual clinically significant in terms of they actually note symptoms and have signs of myocarditis is more rare. So it does appear more that patients that are critically ill have some heart damage. However, it's more in terms of they have organ damage throughout their body just from being critically ill. And while it's certainly true that some patients do get myocarditis, which is a direct injury to the heart due to the virus, it does appear more rare, thankfully.
Now, almost a year into the pandemic, what do we know about the long-term effects of COVID-19 on the heart?
We're still learning as we're going, but we touched on myocarditis, and we're hoping that myocarditis and true heart damage from the virus itself is rare. However, there's certainly other issues. Patients with COVID-19 do seem much more likely to get blood clots, both in their legs as well as in their lungs, which can cause long-term effects on the heart. Likewise, this is predominantly a lung infection. This COVID-19 pneumonia and having a long-term lung disease can certainly also have negative effects on people's hearts and cardiac function.
And what warning signs should people look for that something might not be right with their heart if they have COVID or have recovered from COVID?
Yeah, and I think it's mostly just listening to your body. Obviously chest pain is usually one of hallmarks of myocarditis or an infection in the lining of the heart. But likewise, if people are short of breath or fatigued, in particular, many people are symptomatic while they have COVID-19. I think it's important to pay attention to how your body feels as you get active again. I think a lot of people are, staying home doing Zoom meetings, and so it's kind of hard to know how their heart is functioning and doing. But as they get back into their normal daily routines, I think anyone that has shortness of breath, chest pain, or just fatigue that seems out of proportion should consult with their doctor and be evaluated.
What's your final message to those watching at home?
One thing we have seen, as well as others have across the country, is we've had a lot of patients not presenting early on when they've had signs of strokes or heart attacks. And so I would encourage patients that, while we are still in a pandemic, to seek medical attention if they are having chest pain and or signs or symptoms of a stroke, and that hospitals are taking incredible detail and care to make sure it's a safe environment to receive your routine medical care for other non-COVID related health conditions.
Great reminder. Well, thank you again, Dr. Nassif, for joining us. If you'd like to find out more about COVID-19, including information on testing and vaccines, visit stlukeskc.org/COVID-19. You can also stay up to date with all of the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.